As you know, we spoke last year, we usually have a theme.
Right.
And this year's theme, we're looking at basic, intermediate and advanced nursing care. And we've tried to develop the programme so that our sessions work our way through that. So this morning sessions were very much about basic nursing care,
right.
How to look after your patient, how to look after their nutritional needs, and a little bit about what kind of conditioning therapies people have, because this can be very confusing for nurses,
right.
That you see the same patient with the same disease, but they have a completely different kind of chemotherapy. And why has the doctor chosen that chemotherapy for that patient? What are the underlying principles? So that was a really interesting talk this morning from Anna Sereda that gave us some really good historical backgrounds for why chemotherapy is given and why radiotherapy might not be given in certain clinical situations. Moving forward then, we had sessions for the more intermediate nurse, so somebody who's been qualified for a little bit longer,
right.
And asking them a slightly different question and giving them more information. And this afternoon sessions are for the advanced nurse, so we're thinking of things like graft versus host disease,
right.
And what a complicated process this is. And trying to educate our nurses really from basic level to far more advanced level and taking them through this journey, not just today,
right.
But we're doing that for the rest of the week. So each of our sessions we're hoping will be pitched at a variety of nursing levels. Because as you know, people that come to this conference, we have very new
right.
Qualified nurses all the way up to people who have been qualified for 20 years or more, and we still need to teach both of these groups of nurses something new.
I decided to come to the EBMT because of the, all the people from different countries, talking about bone marrow transplants and about all the side effects of treatments and new treatments, new research. And it's the best place to come because, there are, nurses, doctors from all different, hospitals.
So this morning I went to a session in the nurses group and I saw 3 very interesting presentations about a variety of BMT nursing issues across Europe. We had a lady from Ireland talking about how they infuse different cells, and we had a lady from Portugal telling us some research that they had done, so really interesting sessions.
There was a nutritionist talking, there was Mairead from Dublin talking about administering stem cells, there was a fella talking about early complications of transplant, a really broad brush, and all interesting. Yeah, you can always learn something new. I like to come every year if I can. I'm a transplant coordinator in Belfast, so it's lovely to meet up with other nurses who are working in the same field.
I've been a BMT nurse for 20 years, so I have a lot of experience but always learning new things.